I'm Maddie, and our topic is alarm fatigue.
Hi, I'm Annalise.
And I'm Amber.
IV alarms, bed alarms, and call lights. They're all there to help the nurse aid the patient. But when these alarms are going off constantly, it can be easy for the nurse to tune out the distraction. Our safety analysis project addresses alarm fatigue for both the patient and the nurse and seeks to decrease the amount of alarms going off that are unnecessary and increase the quality of actual alarms so that the patient gets the help they need without hearing all the beeping noises when they're trying to heal.
Studies have indicated that the presence of false and/or clinically insignificant alarms range from 80 to 99%. In the hospital, a single patient is exposed to as many as 700 physiologic monitor alarms in one day. Stakeholders in this safety issue are patients and nurses. Other stakeholders also include the manufacturers of the equipment and physicians, as well as assistive personnel.
Our recommendations for action for this safety issue are hourly rounding to anticipate the patient needs, a differentiation on alarms between crises and just warning, and also a individualized parameter for each alarm. Hourly rounding, the pro of this is decreased number of call lights based on evidence-based practice, decreased stress for both the nurse and the patient, more time for the nurse to chart, improved patient satisfaction, an increase in shift time utilization, and decreased anxiety for the patient as they constantly see their nurse. This way the nurse can anticipate future problems and assist the patient with toileting needs, see any problems and clean them up, or address IV issues before the call light goes off. The con of this is that it's not always necessarily realistic for the nurse to see each patient every hour, especially for the older nurses who are adjusting to a new type of schedule. Recommendation is differentiating between a crisis alarm and a warning alarm. A pro of this is that the staff would understand that certain alarms are more important so they don't become desensitized to all alarms. A con of this recommendation is to give the nurse the authority to adjust alarms to patient needs. By individualizing alarm, this gives the nurse more autonomy in her care and decreases the false alarms that can overwhelm the staff and the patient. A con of this is that it requires excellent knowledge of the alarm system and another nurse to be signing off on any adjustments. Although education is a good thing and reducing false alarms is great, we're wondering if this education is realistic or safe for the patient.
Our outcomes for our patient are to decrease the use in call lights, decrease the number of falls experienced by patients, and decrease anxiety ratings in nurses as patients, as well as to provide better time management for our nurses. To evaluate our outcomes, we're going to keep track of call light use before and after the implement of the change to see if the call lights decrease. We're also going to compare the number of falls our patients experience before and after the change and see what is causing these falls, such as not responding to bed alarms quick enough. We also want to put out patient satisfaction surveys as well as nurse satisfaction surveys to see if patient and nurse anxiety decreases with the implement of hourly rounding. And lastly, we want to take notice to the overtime clocked by nurses as a result of poor time management and not being able to complete all of their duties within the time allotted.
Hi Gloria, how are you doing?
I'm doing good, but I'm really thirsty.
Okay, let me go get you some water.
Okay.
Going to the kitchen. Water. Here's some water, Gloria.
Oh, thank you.
You're welcome. Oh, it's almost lunchtime. I better go check her blood glucose.
Hi, you're back.
Hi, I'm gonna check your blood glucose because it's almost lunch.
Okay, I'm kind of hungry.
Okay, you better order some food.
Okay.
Coke. Oh, your sugar's only at 60. You better get some food, okay?
Okay.
Okay.
Call light.
I'm not going to get that. She's called me so many times today.
Call light. Oh, I really need to go to the bathroom. Oh dear. Well.
Beep, 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 beep.
Oh no,
beep,
Gloria!
beep,
What did you do?
beep,
I needed to use the bathroom.
Oh, I'm sorry, honey.
That didn't go so well. We're implementing a new policy of hourly rounding to keep our patients safe and to minimize the bed alarms. Every time that the nurse comes in the room, she's going to assess pain, make sure the possessions like water or glasses are in reach, reposition the patient, and ask if they need to go to the bathroom. I'll put this right here for our new nurse to check out.
I'm new nurse Maddie, starting my hourly rounds. My patient, Gloria, didn't have enough water in her pitcher this morning, so I'm bringing her some water and ice. It's almost lunchtime, so I'm going to check her blood glucose while I'm in there.
Well, hello.
Hi, Gloria. How are you today?
I'm doing really good.
Good. It's 12 o'clock, so I'm going to mark off my hourly rounding. Is there anything I can get you right now?
Well, I'm doing pretty good. Oh, but I see you brought me more water.
I did, and
Oh.
I noticed it was getting low, so I'm going to pour it in your pitcher and put it closer to you right here.
Oh, thank you.
You're welcome. It's almost lunchtime. Are you hungry?
I am feeling a little hungry.
Do you want me to help you order some food?
I think that would be good. I don't remember how.
Okay. First, I'm going to check your blood glucose.
Okay.
Poke. Okay, you're at 98, so we'll just get you some food here pretty soon, okay?
Okay.
Great. Is there anything I can do to make you feel more comfortable?
I'm doing pretty good.
Okay, I can raise the head of the bed if you want me to, or do you need to go to the bathroom?
Oh, actually, maybe we should go to the bathroom. I'm starting to feel like it, and it takes me a little while to get up.
Yeah, that's a good idea.
Okay.
Let me lower your bed for you. Do you need help moving your legs?
Oh, those work pretty good, so.
Okay. All right, Gloria, all done?
All done.
Oh, perfect. Okay. Well, I'll be back in an hour. I'm gonna have my aide come help you do some lunch, order some lunch, and if you need anything else, page me, but I'll be back in an hour.
Okay, thank you, Nurse Maddie.
You're welcome. Hang in there. You're doing great.
Okay.
That went much better for our patient. She never had to use her call light and had everything she needed. The nurse also clustered her care so that the patient could sleep better. Hourly rounding uses keywords like, I'm here to do my hourly rounding. What can I do to make you more comfortable? I want to make sure you have everything you need. Someone will be back in an hour to round on you. Is it okay if I close the door for privacy? What else can I do for you while I'm here? Timesheets can also be a part of hourly rounding. By writing down what time medications will finish, that will help the patient not have to listen to the beeping alarm when it's done. If I were to put in an antibiotic to run for 4 hours starting at 7, I can write down at 11 that the antibiotic will finish and come check on my patient. That will also be my 11 o'clock hourly rounding.